Live. Okay. Wait for Mary to finish up. Make her famous when she walks by. We're all set.
Special guest.
Exactly, your little walk.
Walking away, Barry. Walking away.
Walking straight.
Nice.
I'm telling you though, this is saving me my neck and my back.
And you. So you're doing enough for you.
Yes.
Girls doing
I
well?
don't know what I would do without my marrow. Honestly. The girls are doing fine. Desiree's moving into her. So I tell you, both of my kids have a both expiration release of apartment 1 day apart. So
Oh my God.
I gotta get them moved out. One in San Francisco and San Diego. So Desiree's moving from San Francisco, San Jose, and Lisa is moving from San Diego to Laguna Niguel. All
She's
in the
moving
same
up in the
weekend.
world.
Yeah, hey, they taking care of themselves, that's all right.
That's all you hope for, right? Wanna
Have a
check-
good one.
Check the, just pull it up on YouTube Live, make sure it's looking good.
You too.
And then I'll get started, get this party started, get Brenda where she feels nice and cool in this crazy heat.
Can I do it through the app or no? Yeah.
Just do the app and just look at you chiropractic.
No one paper.
I am ready to go home.
Bye.
That's right. Yeah.
Yeah. Oh my gosh, I do. I know. Yep, you're live.
Well, good. Can you hear the sound too?
Oh, let's see.
Oh, good. Sound's working. You can hear yourself. Amazing how that works. All right. See you later. Bye.
Bye, guys.
Okay. So, this is our in-office workshop. We want to go over exactly how all of this chiropractic works to make you feel better physically, psychologically, mood, attitude, everything. And the biggest thing is making sure that you stay this way so you maintain your own body's health. My job is to see you enough so I don't have to see you. That's what it comes down to. Okay, we've talked about this before. This explains how we do it. Okay? A lot of it is the first part of the very top portion here is going to be exactly what our purpose is, our mindset as chiropractors, our philosophy. Really, its perception of chiropractic care includes treatment beyond the back and neck to help patients achieve complete wellness of the body and mind by the choice to have good nutrition, exercise, maintain a healthy nervous system. As chiropractors, we move the bones, yes. We change alignment, yes. We cause bone motion, good. We want to make sure the nerves, because the nerves control your health, maintain that so your body stays healthy, tolerates more stress. That's the plan. Okay. The second part is chiropractors treat the spine and influence the function of the nervous system. That is what we're here for. The body embryology, by how the body develops, is huge. After the sperm and egg come together, I'm not going to go over the whole sperm and egg thing, how that works, but if people know that stuff, is the body forms this group of cells called the mesoderm. Okay? That mesoderm, after 7 days of fertilization, starts to specialize in different cells, become part of the human body, developing that eventually. Starts with a primitive node and primitive streak. What do you think this forms in the human adult body?
Oh, a child.
A child, but what part of the child's body?
The spine, the brain.
The brain?
First.
The brain, and what's inside the spine?
Like the lungs and the
Spinal cord, you said?
spinal
Spinal cord, right? Yeah. The soft tissue.
Yeah.
This is the first thing in the form, the brain spinal cord. It has developed from here to different parts of the body. See, the body, when the sperm come together, it's just two cells, but it develops and divides over its own system to make these form, and then it progresses from here to the rest of the body. So you need this to form first so the body can form individually. After that comes the wiring system of the body, the wiring system, nerves, hence, from the right side of the body, down through the spinal thalamic tract, the spinal cord, down the right side, and then down here, same side. Okay, how the body works. Next part, upper part of the brain, these nerves form again, from here, down here, opposite side, and then same side. Okay, kind of looking like somewhat of a person now, right? Okay, once you form that, form different organs such as, say, kidneys, okay, a liver, Put it in blue because that's what I have in my hand, and the heart. Okay. Looks like a hodgepodge of things, a kid's artistic ability. This is my artistic ability, people. That's what I do, okay? And again, because I'm not an artist, I'll draw the hands and arms, give some texture, like that. All right, any questions about my artistic ability? Please say, I don't have any, because I agree with you.
Oh.
Okay? Sea turtle, maybe, I don't know. Something like that. But it gets your body to understand, okay, once I have the human fetus, if you want to call it that, pre-birth, I form the brain, the spinal cord. From there, all the nerves branch out to every organ of the body, so my body can function and grow that way. The heart starts out as a node, then it grows into the heart, starts beating, and everything else function happens. Has to start somewhere, is where it starts from. Any questions about this? As before the baby is born, the skull forms. Okay? And then the spinal bones form, like you mentioned before, the spinal column to support the baby as it is born, and then starts to crawl and starts to walk. All right, again, I made a bigger mess of my picture. Any questions?
Yep.
It's a picture because I'm going to erase this right now before I get nauseous. Okay? So that's how things want to start forming. And realize this nerve here that goes, for example, down the arm, down the leg, the head, that's what we're talking about next. Okay, that's the biggest thing. The next part of the page, talk about what controls development and function, went through that portion. Then we'll talk about the energy and electrical impulses and how they work. Once I erase my artistic abilities, that out of the way so it's no longer legible, watchable. So we've looked at one nerve root, how the nerves work. They form somewhat like a tube here. So we talked about a normal nerve. Normal electrical impulse is by a sine wave where it goes all the way through. Normal high and low, that's the plan. A normal nerve stays relaxed. That point when it innervates, maybe a muscle of the arm or shoulder or joint, feels relaxed and strong the whole time. Okay, organs over here, same thing. Makes the organs feel relaxed, in a relaxed state the whole time. Next part is going to be if the nerve gets irritated, sometimes being pinched by an actual bone or other injuries too, becomes hyper to higher voltage than normal. That causes stress states where the overall muscle may go into spasm, causing sharp pain. Organs may cause more intestinal tract, sometimes more constipation. The bladder will stop working too, where it won't allow things to pass through. Even the heart rate too, we under stress, what happens when you see a scary movie? That when heart rate goes up, you go, what the heck was that? Then it goes down again. Okay? If the body stays in a stressed state, the nerves will go from hyperactive to more of a subdued, minimal sine wave and shut down. What do you think when it goes from here to here, the muscle goes to spasm, sharp pain, correct?
Mm-hmm.
What happens here? How do you think the muscle is being affected?
The muscle's probably like tightening up.
It stays tight and also weak too. Someone comes into my office and says, I had neck pain, back pain, arm pain, shoulder pain a couple months ago. Now it just feels my arms weak all the time. It feels my neck's weak all the time. So you want to go from that state to here. I go, okay, now this is the worst. It is more of a chronic long-term situation. So once something gets stuck in that state, the muscle may get weak, but the body stays in a stress state. Any questions about this? Is more of a clean drawing, right?
Mm-hmm.
Legible. It's decent.
It's good.
I'd get at least a C plus in this one.
Yeah, you're
Art
pretty good.
class. Getting better, getting better.
I was an art major.
Oh gosh, feel embarrassed.
No, you're doing fine.
Feel embarrassed, Brenda.
No, you're fine.
Here, we talk about the next page is going to be how nerves are affected after birth. This goes along. Did she give you this one too? Good.
Yeah.
These go together.
Okay.
This one and this one. Okay. To see how the body's affected after birth when spinal problems occur. So this one, so you get this in the notes down the line once I post this and add this to the actual YouTube link. All right. So we talk about, let's go through how this chart works. Here, on your very far left side, correct, is your spinal column. That's just part of it. The middle part is going to be the location of the actual body system. Maybe your kidneys, your lungs, your heart, your arm, your legs, your head, anything. Okay, your gallbladder, whatever it might be. The last part is going to be how the systems are affected, meaning your symptoms of your body, the effects of the body. In either a relaxed, normal functioning state or a stress state. Okay, so let's go through this, matching up with this other form too, this one here. You have the same one, correct? We have that one, okay, I have that one too. Huh. Different forms for me and for you.
Oh, okay.
We have the same one here.
All right.
It's different versions of it.
Oh, okay.
Okay. When you go through this one, let's talk about first of all how the nerves can affect exercise, your ability to get strong, keep your muscles moving. So number one, over here, is the effects of the body being number one, exercise. Okay? Can your muscles get strong, stay relaxed, for example, things like that. Go through this form, we'll talk about subluxation, which means basically where a nerve gets pinched, causing a functional change of C6, affects the neck stiffness, upper arm pain. So let's go to this form here, C6, right across there, perfect. Talks about upper arm pain, neck stiffness, tonsillitis, whooping, coughing, croup. Okay, realize those nerves affect not only the muscles that go in the arm and neck, but also affect the throat. People come in here, my last class, I think 2 classes ago, mentioned that her voice had changed.
Really?
From hoarse to more of a smooth voice. It was weird.
That's weird.
Oh, that's what I said, it was weird. I was like, oh, that makes sense. I looked at my phone, that makes sense, because it causes problems with the tonsils, or relax your tonsils if the neck gets better. Relax the C6 area, get those nerves to calm down, by causing the spine to move, makes overall muscles and organs function better. People come in here all the time where they feel like they're being choked. And right now, Stephanie, she gave me proof to talk about it. They actually misdiagnosed her as having a tonsil infection, between antibiotics and causing even a biopsy to look for things. They didn't need that. It's coming from the nerves. It didn't look that way. There's a moth right there. So I'll get it. Hold on. I got it.
I got it, yeah, right.
Perfect. I played volleyball once in my life. That helped out right there.
That used to be
Okay.
my favorite sport. Was
There you
volleyball.
go. Beach volleyball or gym.
No, gym indoor. When I
Nice.
was in high school.
There you go. 6 men. Swim in. Next one is going to be T1. Okay. T1 on your form again. Location would be the arms of the down to the elbow, including hands, wrists, and fingers, esophagus, and trachea again, where that neck area. Okay. So it talks about here from that location causing problems with asthma, coughing, difficulty breathing, shortness of breath, pain in the lower arms and hands. People come in all the time with problems where it runs from the neck. Is it turned on? I hope so. Hold on. Technical error. Let me go plug it in. I'll be right back. Simple things, simple things. Yep.
Yeah, my friend had a stroke. The first thing I noticed about her was her voice changed.
It's amazing how the nerves affect the body.
Yeah, her voice was, I didn't recognize her voice at first. It was really high.
It changes everything. We don't realize how important the nerves are to keep things strong and healthy. Okay. So that T1 again affects here. Now that we're plugged in, it runs down the. Oh,
There you go.
there it goes. Down the. Hold on. Still difficulties. Plug it all in. Okay, Taylor. Watching the video still. You are going to be on suspension. Now plug it in. There you go. Plug it in. Try it again. Runs down the arms. Hey, that's how it works.
That's great. Okay.
A nerve in the neck runs down the arms, causing pain, weakness, tingling, burning, anything like that. So you have to be careful when you look at someone's symptoms. Do they have an elbow problem? Maybe. Shoulder problem? Maybe. Neck problem with the numbness down the arms, hands all the way? Yes. Look at the big picture. Don't misdiagnose things. Take a second. to make sure you understand where things can come from as your own patient. You're your best advocate for your health. So any person watching this, making sure that you understand where things can come from, rule it in or rule it out. What we do is take an x-ray to rule in or rule out a spinal alignment that can cause it to happen, match up your symptoms, give you the best chance of the best recovery. When diagnosed properly. If it's diagnosed wrong, chance of recovery becomes slim to none. You're guessing at that point. Okay. Any questions about the first one, how it affects your ability to stay strong and exercise and muscle control? Any questions? No? Okay. Second one's going to be ability to digest food properly. Okay. Sometimes people talk about that maintaining a certain weight, and I'm eating well. I'm doing the right things and exercising. How come I'm not losing weight or feeling like I have more energy? Okay, a lot of that's going to come from, say, T6 down here. Okay, affects location of which area?
Stomach.
The stomach, yeah, good. So make sure I saw that properly. Controls nervous stomach, indigestion, heartburn, dyspepsia. I still gotta look up what dyspepsia means. I'm not sure
I
anymore.
don't either.
I'll Google that later for you guys. Okay? So that's what we understand what that is. Okay? But it affects your ability to, when you have nervous stomach, throwing up all the time, just nauseous all the time too, affects your overall life. That effects goes back to your brain, keeps your body under stress. Especially if we're treating it and we're not getting the right response. So our job is to release that pressure at T6 so that stomach feels better, and also to not in the form, affects your gallbladder and also your pancreas. Make sure everything works properly. That's the plan. Okay? The next part here is going to be sleep. Most people I know, if they're honest, do not sleep as well as they would like. They either sleep not enough, they wake up in pain, or they wake up where they're not recharged. My job is to see how do we get body to heal enough to stay in a relaxed state so they can recharge. So going down to sleep, we look at C1 in the neck, right here. Affects here in the neck, but also on this form, it's hard to see a little bit, it affects everything in the body.
Wow, okay.
Okay, C1 location on your paper again, blood supply of the head, pituitary gland, which is part of your adrenals, your scalp, bones of the face, brain, inner, middle ear, along with sympathetic nervous system. You go over what sympathetic nervous system is, sympathetic? Go over that before? Okay, sympathetic. This is the one of the highlights of this talk every time I do it. This is how your body stays in relaxed state or non-relaxed state. On this here, we talk about the autonomic nervous system. Okay, automatic system is autonomic. Your breathing, your heart rate, those things happen automatically. Okay, when your body's under stress, say stress, and relax. I'm going to do it a different way than I normally do it. Okay. Body's under stress. Everything down here, your sympathetic and parasympathetic, are these things down here, they control some of that. Let's do parasympathetic. Parasympathetic. It's pathetic. And then over here, we'll talk about sympathetic. It'll be backwards on the video, but get the highlight. Sympathetic is in red, parasympathetic in blue. Okay. Parasympathetic is your rest and relaxation. That's when nerves are calmed down. That's when your overall body stays in a relaxed, balanced state, where our body does not want to become stressed. Okay? Sympathetic is when your body's in a stress state. And over time, as that stays at a higher level, overall body goes from happy to sad, grouchy, moody, pain all the time. You don't sleep well. Okay, you get bags under your eyes. That's all I got for you. That's all I got for you. That's all I got.
That's pretty good.
All right. You know, from an artist, I'll take that as a compliment.
That's good.
Okay. We want to get this to shut down and making the nerves work better. So you go to more of a relaxed person where they're here again. Yay, I'm happy again. Okay? But it takes shutting the nerves down so it doesn't get pinched, so they don't become irritated, get to that state. Part of it, your brain, your nerves will send signals to your brain, from your brain to your adrenals on top of your kidneys to produce hormones to either stay in here or stay in here. If we're under stress, we produce more cortisol, catecholamines to stay in a stress state. When we're more relaxed, you stay more serotonin, more endorphins in a more relaxed state. Okay, we want the better hormones here. How do we do that? Calm down the nerves, maintain that cause motion in your spine so your body can stay relaxed. If we get here, produce more hormones for this area over time, that becomes our normal habit routine. We want to maintain that better balance on this side versus here. If we don't, if you stop moving, our joints stop moving, our nerves become irritated, in this state, that's when you get systems like this to happen. People come in here with problems with arrhythmia, heart problems, lung problems, they can't breathe well, they don't digest food well, they don't sleep well. Their overall digestive tract is just haywire. Headaches, migraines, nausea all the time. They stay in this stress state, your body can't get out of it on its own. Our job is to go from here to here by causing the joint motion to calm everything down. So from the nerve perspective, the nerves calm down. That's step one. Once you've done that, we get your body to move on its own. That produces those hormones that allow you to stay in this state, relaxed state, versus in a stress state. Maintain those habits like you have. At that point, you stay here over time, tolerate more stress in your environment. You know how to combat that stress by moving more. That's the plan. That's our goal here. So you move more, we move you inside, you move you outside, overall body stays healthy. You tolerate the stress you deal with every day, so you sleep better. You exercise and it's effective. You diet, it works well for you. Your mood and attitude stays healthy. That's the next one, your form 2. PMA, the next one, your form, is really how your mood, your attitude feels. Okay? Can you stay healthy that way? That's the plan. Our job is to make sure we get you here so you maintain a healthy, positive, self-confident, self-esteem attitude to maintain your routine. Last one is HNS, healthy nervous system. I'll just give it to you. And it says too right there from Gray's Anatomy, the Bible, Gray's Anatomy, Bible is for anyone who studies physiology, controls and coordinates all the organ structure of the human body. That's your healthy nervous system. Our job is to maintain that so you can stay here. You can have a better balance to stay out of here, out of sad face guy, or a happy face girl, or guy, whatever it is.
I was in the right-hand stage for like 2 years in a row, which was really bad.
Why? Why do you stay over here?
I had 2 parents that were ill at the same time. I was taking care of both of them at the same time. So I only slept maybe like 1-2 hours a night. I just go constantly, you know.
You had to stay in that stress state to go.
And I lost probably like 25 pounds. But
Yeah.
I kept going, you know.
It became almost out of necessity. Once that stress was over, somewhat, did your body adapt back to normal right away on its own, or how did you adjust back to normal?
It probably took about 6 months before I got back to what I would call normal again.
Yeah.
So I think at first I was sleeping maybe like 10 hours a day or something when I got.
You kind of went the other way.
Went the other way too, and I was
Just
too far, the other direction. I had to try to make myself balance and come back to 8 hours, you know.
It just takes time. And once you get, and it took you like 6 months, it takes to rebalance your hormones to get to change your state about 30 to 60 days. Minimum. Do it consistently. So a 30-day diet doesn't work. 3-day gym membership doesn't work. Minimum, when I talk to trainers, do our podcast show, and talk to experts on it that train people, they say minimum 3 months to see a consistent result that you can't go backwards anymore. You change your lifestyle, you change your body physiologically, chemically and hormonally to maintain a better state or different states. But it takes the work, the energy, the time, as you put in. All right. Anything else? Any other questions, comments, concerns, answers? Does that kind of give you the big picture we're doing now? I care about your spine, yes. I care about your pain, yes. I care more about how to get you out of there so you stay out of there. We will treat you, but also educate at the same time. Educate you so you learn the habits, the exercise we're going to give you, the stretches and exercise in the videos, how to strengthen and keep your body flexible. That makes you know, okay, if I'm here, I want to stay here, I have to do this. If I fall off a little bit, always being human, I got to get back doing this to get here. And we give you the tools to make sure you can get here and stay here. My best patient was that tell me, hey, I came in for 3 months. At that point, I felt great. I come back 3 or 4 times a year for 2 weeks. I feel my body kind of just not normal. I don't feel my normal state anymore. Great, we retune you up again. Literally, that when you get back on your feet. It all comes down to
It's the whole package, yeah, mentally, physically.
everything.
You know, you have to have the balance or it doesn't work.
Well, and by doing the physical, you help improve your mental. There's a good book called Blink where your body actually, when it gets to a serotonin state, a more endorphin release state, your body becomes more open to ideas. You have that thing that you were thinking about. You figured it out. So by working out and then doing your mindfulness, some people will say, at that point you get a better result from that. When you're fatigued or stressed, our body naturally wants to shut down, tighten up, not do anything. You got to fight that body chemical change to move, to make sure your body gets to a better moving state, become more relaxed state. You move, you relax. That's a very simple way to look at it. Mindfulness comes from that too, how we think. Movement helps to support that. All right, any questions at all?
If I understand that, I changed my diet, the way I ate about last October,
There you go.
and I've maintained it so far, and that's what was really difficult.
So changing your diet too, are your taste buds different? Do things taste differently?
A little bit, but it, you know, more vegetables, more fruit, and then, have an app where you have a goal and you have to
Yes.
keep track of what you eat, so
Perfect.
I know where I'm at, I can manage that, you know.
And you see that difference to where if I'm off of my habit, and then my body doesn't feel good. Good. It does. It's not easy to get to. Once you've gotten there, it's easy to maintain somewhat.
Right.
How long did it take you to get to that habit where it was easy to maintain? You found a routine out of it.
I'll say about 6 months.
Yeah.
Easily, you know, because everything else I tried, you know, if you try like fad diets and different, they don't work. Because you're gonna just gain that weight back, you keep going back to old eating habits and stuff.
Your
so-
body can't adapt and stay adapted at minimum 3 months. 6 months, great.
Mhm.
But people want that quick fix. It's called the drug.
Yeah.
Take the drug if you want. We'll fix things over here. You change your diet routine. Give yourself time to just get there and stay there. It's gonna sometimes suck getting there.
Yeah.
Not gonna feel good. You're gonna go, what am I doing? When you realize the big result, hey, someone's done this before. They're trying to coach me to get there. Maintain that so you can get that and know the results are there.
Well, me and my husband were doing it together, and then
Yeah.
he's kind of fell off of the wagon. I'm trying to get him back on board.
Yes.
Because we're both doing it. It works much better because what I cook, you know, I
Of
have
course.
2 different kinds of meals.
Too much work.
That's right.
It's healthy food, TV dinner.
Yeah.
Perfect. But when you have that, you know what good for you. You feel it feels good on you. Great, do it. I used to drink Diet Coke about 15 years ago. Loved them.
Mhm.
I said, you know, I read something about it, I'm like, this is ridiculous. It's going to kill me. As some people don't know, Diet Coke is not good for you.
Mhm.
I'll tell my wife because she loves Diet Cokes.
Well, I used to too. I used to drink.
Yeah.
I would take 2 big liters to work because my job was really stressful,
Perfect.
and I would drink those like all day long.
2
So I was
liters
just-
a
yeah,
day.
Yeah, and
Do you
then
buy stock where you got a discount for that or no?
I bought them in bulk, which is
Okay.
really bad, and
Yeah.
so I finally realized, you know, this is kind of crazy. I'm so hyped up I can't sleep at night. This has got to be bad. You know, I have to.
Your body
drink
will
this
change
stuff.
on that. It's a toxin to your body.
Yeah.
But when you go away from that, and you go back, for myself, I went back and tried to drink Diet Coke. I'm like, this doesn't feel good. This doesn't taste the same.
Mhm. Doesn't taste the same.
Your
I gave
taste
it up.
buds will change to where you don't require that to feel good.
Yeah.
You know, chocolate is a thing. I love chocolate. So I'm not away from chocolate. But can I minimize what's not good for me overall? You know, we have to have that self-control sometimes. All right? You're on the right track. This is you. Think healthy and realize it takes time, energy, and effort. And once you're there, it's easy to maintain. You've already climbed the hill. Everybody's adapted. Stay there. That's why the working out, the swimming, everything you're doing now, maintain it.
Yeah, well, exercise now, since I had the injury.
Yeah.
I have to remember I'm starting at 0, you know, and I'm at like 5% now that I have to just keep working at it. I'll
And
get
as you
back.
work, as you tell yourself, the weeks, months into require, you have years and years and years and years left to live, so why not do the work now? What upsets me, Brenda, is when people are told by the medical doctor, physical therapist, hey, it hurts, so stop moving. That will make your body atrophy, tighten, weaken, the reverse of getting healthy and staying healthy.
Yeah, or they prescribe you medications, which that just, to me, that just masks the whole problem. It's not.
Feel
really,
nothing.
Right, feel nothing, and then you start getting other side effects from it, all the drugs that are.
You take one drug for pain, so you don't sleep well, so you take a drug for sleeping. That causes constipation, you take a drug for constipation.
Yeah.
Now you have a domino effect of now all these things in your body versus taking care of the root problem causing the pain. That's what we want people to understand is, I don't care if you see a chiropractor or whatever it is, find the root problem and treat that, fix that, so you don't have any problems. It should not be a medication rest of your life. There's still an opioid crisis in the US. 300 people die a day minimum taking, 300 US citizens die a day every day who take medication the correct way. The correct way. So why do we keep doing it? Because we're told to do that. We trust our doctors, which we kind of should, but can we do something else? Can we move better? Can we take better supplements? Can we do things for our own body by going on that thing called Google, researching what is good for me today? Like I said, using the app, what works for me, that one write down the foods I need, if that one works for me, go for it. All right?
Also have to do with your age, what's appropriate, that's the thing, to know
Yeah.
what is appropriate for your age, because things change, as you get older, so.
And if anything that I've seen is, at least physical activity wise, it takes longer to get there. But once you get there, it's easier to maintain because you're I don't call it wise enough, but you have discipline enough, self-control. Okay, I realize that's good for me. I'm going to maintain that. There's less distractions, per se. But knowing that too, doing your own homework works for your body, different from somebody else. I'm a morning person. I get up at 5, boom, ready to go. My wife says, get the heck out because I'm still sleeping. She'll be up reading a book or whatever it is, and I'm already asleep. I'm out. She's a night owl. I'm a morning person. Work with what works for you and realize it's your body. When I talk to my patients, it's about what they need, what they want. But by the best, work with it. Yeah. You're on the right track. Everyone has their own pace. Find your pace, stick with it. No one's the same person.
I'm like your wife, I'm the night person.
Yeah, good for you.
My husband can go both ways, which really, I don't understand.
He's a robot.
Yeah.
He's a robot. He's an alien.
Yeah, he is.
I need about 6-7 hours of sleep a night, and I'm good. But I need that. But in the morning, once I get I think a certain point of energy and level, my body just goes, okay, I'm gonna go. But everyone's different. Listen to your body. Some people have to stretch more. Some people have to strengthen more. Find a chiropractor. Find out someone to help you understand what you need. Get the next level of health, so your body stays strong for the work you do. If you stay strong for the work you do, then your overall body, your heart, your lungs, your prostate, everything in your body stays healthy. Toxins don't build up to cause cancer. Cancer, I did a talk with a lady who does breast cancer exams through a machine called SurTouch, where it's more of a tactile screening out for breast cancer. Even she's done the research saying, hey look, cancer is only 5% and she's seen about 2-3% of genetics. The rest is going to be your lifestyle. What have you done through the years, through the decades, to make your body healthy or unhealthy, to make you high risk or lower risk for cancer? It's a build-up process. But it takes years of doing the right thing to see a difference in your body. That's it.
Okay, good job, thanks.
Thank you. Let the golf clap. That's all it is, How do we get things to stay healthy and get that way and stay that way?